Virtual Reality in Medical Training, A Leap Forward for Education. Title: Virtual Reality in Medical Training, A Leap Forward for Education. Introduction. In recent years, advancements in technology have significantly transformed various industries, including the field of education. One such transformative technology is virtual reality, VR. Virtual reality has gained traction as a powerful tool in medical training, allowing educators to create immersive and realistic simulations for medical students. With its potential to revolutionize the way medical education is delivered, VR holds promise in improving learning outcomes, enhancing practical skills, and ultimately benefiting patients. This article explores the applications and benefits of virtual reality in medical training, highlighting the significant leap forward it offers for healthcare education. 1. Enhancing immersive learning experiences. Virtual reality transports medical students into realistic virtual environments, enabling them to engage in immersive learning experiences. Unlike traditional teaching methods, VR simulations provide students with the opportunity to put theory into practice, resulting in deeper understanding and retention of medical knowledge. Through virtual reality, students can visualize complex anatomical structures, interact with virtual patients, and perform medical procedures in a safe and controlled environment. This immersive learning experience allows students to bridge the gap between theory and practice, fostering practical skills acquisition and boosting confidence. 2. Replicating real-life scenarios. In medical training, exposure to real-life scenarios is crucial. However, genuine patient encounters can be limited, depending on various factors such as patient availability and ethical considerations. Virtual reality addresses this challenge by replicating real-life scenarios, offering a diverse range of medical cases for students to experience. Students can encounter different patient profiles, symptoms, and conditions, thus broadening their knowledge base and improving diagnostic and decision-making abilities. VR simulations can present rare or critical cases, providing valuable exposure that might otherwise be difficult to access. By allowing repeated exposure to challenging situations, virtual reality helps students become better prepared for actual clinical work. 3. Developing practical skills. Medical procedures often require hands-on practice, which can be challenging to achieve using traditional teaching methods alone. Virtual reality offers a safe and controlled environment for medical students to develop and refine their practical skills without compromising patient safety. Simulations can involve activities such as surgical procedures, injection techniques, or even communication and patient management. VR platforms provide haptic feedback and realistic visual and auditory cues, creating a sense of presence and enhancing the realism of the learning experience. This allows students to develop muscle memory, improve spatial awareness, and fine-tune their motor skills, which are critical for performing precise medical interventions. 4. Promoting collaboration and interdisciplinary learning. Virtual reality in medical training not only benefits individual students but also promotes collaboration and interdisciplinary learning. VR platforms can facilitate multi-user experiences, enabling medical students to interact and work together in a virtual environment. This collaborative aspect simulates real-life teamwork scenarios, fostering effective communication, coordination, and mutual understanding among future healthcare professionals. 5. Improving accessibility and flexibility. Virtual reality is inherently scalable and accessible, making it an ideal tool for medical education. With the increasing availability of affordable VR headsets, medical institutions can provide students with the necessary equipment for immersive learning. Additionally, VR simulations can be accessed remotely, overcoming limitations related to physical classroom space and accommodating a larger number of students. This flexibility allows medical students to learn at their own pace, revisit challenging cases, and practice procedures, leading to better preparation for their future clinical responsibilities. 6. Assessing competencies and performance. In addition to its educational benefits, virtual reality offers valuable tools for assessing students' competencies and performance. VR simulations can capture various metrics, including time taken to complete a procedure, accuracy of movements, and decision-making skills. Instructors can review and analyze these objective data for evaluating individual students or groups, providing targeted feedback for improvement. Medical simulations involving virtual patients and scenarios must be designed and implemented responsibly to ensure patient confidentiality and privacy. Additionally, the potential for desensitization or emotional detachment in students should be monitored and mitigated. Educators and developers must prioritize ethical guidelines to ensure that virtual reality is used ethically and responsibly in the context of medical education. 8. Advancing research and innovation. The integration of virtual reality in medical training also presents opportunities for research and innovation in the healthcare field. Researchers can conduct studies to evaluate the effectiveness of VR simulations in improving learning outcomes, comparing traditional methods to virtual reality-based education. Furthermore, the development of new VR applications and technologies for medical training can expand the possibilities for innovative educational approaches. As research continues to support the benefits of virtual reality, it will encourage further advancements and adoption in the field of medical education. The cost of VR equipment and software can be a significant barrier for some institutions, hindering accessibility and adoption. Additionally, there may be resistance from educators and students who are unfamiliar with or skeptical about the use of virtual reality in education. 10. Continuous improvement and evolving technology. As with any technology, virtual reality in medical training will continue to evolve and improve over time. Additionally, incorporating artificial intelligence and machine learning algorithms into VR platforms can enable adaptive learning experiences tailored to individual students' needs. With ongoing development and continuous improvement, virtual reality will undoubtedly become an integral part of medical education, transforming the way future healthcare professionals are trained. CME programs are designed to provide healthcare professionals with ongoing learning opportunities and updates in their respective fields. 12. Addressing cultural sensitivity and diversity. When designing virtual reality simulations for medical training, it is essential to consider cultural sensitivity and diversity. Healthcare professionals must be trained to care for patients from different cultural and ethnic backgrounds, as cultural competence plays a vital role in providing quality healthcare. Virtual reality can be utilized to create scenarios that reflect diverse patient populations, their unique beliefs, and cultural practices. 13. Ensuring long-term skill retention. While virtual reality can provide an excellent learning experience, it is crucial to ensure long-term skill retention among medical students.